Hello, good afternoon. My name is Monika Kobylecka. I'm a licensed acupuncturist at Children's Hospital Los Angeles, working with the pediatric pain team as well as the palliative team, and also doing some employee acupuncture. So those are all my different roles at the hospital. So I practice a Japanese type of acupuncture called Kiko Matsumoto style. So this may be the first that you're hearing about not only the style, but about the fact that there are different types of acupuncture. So in fact, there are quite a few. So one of the things that I really like to say whenever talking to people about acupuncture is that if you've ever tried it once and you didn't like it, it didn't feel like it worked for you, then it's probably a good idea to try it again, try to find a different type of acupuncture or just a different practitioner. So that's true, for me or anybody else that you have seen. So I'd like to open with that. Since we're in this virtual setting this afternoon, what I thought I would do is just mix things up a little bit, and instead of just providing you with facts about acupuncture or answering some of those specific questions, I wanted to give you some tools where you yourself can apply acupuncture to help you. So obviously we're not going to use needles. We're just going to focus on using our hands and applying pressure to different points. And I'm just going to highlight some of the very generic points, but that are helpful in situations either as a little bit of prevention or strengthening. For example, our eyes that we use a lot, especially staring at these screens, and a few other things. So before I get started with that specifically, I do want to mention that with acupuncture, we, for the most part, and especially when it comes to Japanese acupuncture, we don't really have a set of point protocols that apply. Let's say if you have back pain, then you're going to receive always the same set of points that your friend with back pain may have. So that's one of the key things to remember, that with acupuncture, we have the ability to really cater to each patient, make the treatments very individualized and specific for that particular patient in that moment. So our skills as acupuncturists rely on a diagnostic process that's a little bit different, obviously, than Western medicine. When you see an acupuncturist, very often they'll rely on taking your pulse as a way to find out what's going on with you at the moment. They may even, some of them may look at your tongue, which represents a map of the internal organs, and we look for different things in that. So in addition to it, for example, in Japanese acupuncture, part of the diagnostic process will also include pressing on the abdomen. This is like a big map of our vitals, the way that if you go to a Western practitioner, the first thing they're going to do most likely is take your blood pressure, measure your temperature, etc. So for us, one of the key factors is also checking what's going on the abdomen. So you may experience that they're going to press on different areas of the abdomen looking for what are called reflexes. And then actually by changing that pattern, softening those areas that may be a little bit painful or uncomfortable, changing those things will actually improve the symptoms that you're coming in for. So I know that's a little bit, maybe a little more technical than you want to hear, but just giving you a tiny glimpse of what you may be in for when you go see somebody for acupuncture. But there are certain points that are just kind of generic points, if you will. Maybe some of you have already done this, where you Google, acupressure points for a headache or back pain or something like that. So certainly we do have some things that we can kind of generically apply to different things. So that's what I'm going to go over. A lot of acupuncture is also about prevention. So actually in this session, part of my goal too is to just help you strengthen, again, some of these, strengthen your immune system a tiny bit, help support it, strengthen your eyes, maybe calm the nervous system, something that we probably all could use in this 2020 year that has been just so full of surprises. So you don't need anything besides your hands for this. Since we're going to be touching, you're going to be touching your face, you're going to be touching your body. Certainly, grab that hand sanitizer or wash your hands before we get started. But otherwise, that's all you need. So what I'm going to do is start kind of from the top and then move down the body and just introduce you to some of the big hitters that we have in our medicine. So one of the reason I also want to start with the head is because our eyes are here, and there are actually quite a few points that you can use to sort of strengthen the eyes, or when you're really tired, you've been reading for a long time, you've been staring at the screen for a long time, you have sun in your eyes the way I do for for a long part of the day, anything like that. That kind of tired feeling that you experience with the eyes, those muscles, we can do a few things to help strengthen them. So these points that I'm gonna, and this little like massage technique can be applied to anybody. This is something we teach from, to pediatric patients and kids in general when they're in school, when they're sitting at their desk, for example, all the way up to obviously adults. So the first areas, very, very simply, we can use 2 points. One is located right at the edge of the eyebrow, and the other one's right in the middle of the eyebrow. You can also think of like if you're looking in the mirror, for example, or you can see yourself, think of like the middle of the eye or the center of the pupil, that line. So one is right in the center, in the middle of the eyebrows. The other one's right in the inside edge of the eyebrows. So what we can do, an easy technique for this particular one here, is to simply take your fingers like this and put one, at the edge of the eyebrow here on the inside. So I have pressure just using the side of my nail. And then the other one, I'm using my thumbs to press here. And then a cool trick is that if you're sitting at a desk, I don't have one in front of me exactly, but if you're sitting in front of a desk, you can simply lean your elbows on the desk and then just slightly lean into into your hands, so you'll feel a little bit of pressure. Whenever you're doing this, the intention is not to cause pain. It's not to make yourself feel really uncomfortable. It's just to apply a little bit of pressure. So let's say that you kind of make this a habit every time you are at an end of a Zoom call. Every time you get off the phone on a phone call, you could simply do this. Or better yet, if you are on the phone, you could simply use one hand, or if your hand's free, use both. So you can't really overdo this, but it's a nice, very generalized points for strengthening the eyes in general. The other part, which is might surprise some of you, is that these points are also, they have 2 other functions that are kind of more global and could be useful. One is that they're really great kind of painkiller points, is one way to think of them. So they actually, for patients, one of the main uses for these, a lot of patients that have lupus, for example, have a pattern where they respond quite well to these points. So teaching, those patients to have this as a technique, kind of, apply it every day, every other day if they can, but more often serves as a little bit of prevention and may help to reduce some of the pain during a crisis. So this is another function. And then, completely unrelated, but for women who are going into perimenopause, menopause, and even a little bit after, these are generally speaking, again, we always want to identify the individual pattern, but very often these points also come in handy. So they seem to, just support some of the hormone balance in the body. Overall, with acupuncture, we're not adding anything, we're not taking anything away from the body. What we're doing is really communicating with the body and asking it to regulate itself. So think of it as, with acupuncture, what we're doing is saying to your system, to the patient system, is, hey, you forgot about this area. Could you bring the attention here and then take care of it? So this is why the messages can be different, and this is also why we can use points all over the body. It doesn't have to be in the same area where they're having, they're experiencing discomfort. So again, this is a very, really great points that have many different beneficial uses. Most importantly for the discussion here, and to encourage you to do them, is to maintain your eye health. So we have 2 other sets of points that are also super helpful to help support the eyes in general. One is, think of it as if I were to draw a line from the center of my pupils to the back of my head. So imagine, a straight line going across to the back. So project to where, where that line would exit on the back of the head, and then on, on both sides, and massage those areas. That's usually, so I'm using 2 fingers, putting, again, not a lot of pressure. This should not be uncomfortable, but massage the back of the head. Now here's the trick. It's really important to do this while you're looking as far away as possible. So ideally, if you can step outside and look at the horizon, that's the best. But if you're, let's say you're in a room in the office, either try to look into the furthest corner of the office, of the room, or you could also just imagine relaxing your eyes until you sort of have a sense, like you can just sort of soften your vision where you're aware of your body suddenly. So if that makes sense to you, you can do that. Otherwise, don't worry about it. Just try to look as far away as possible. When you're massaging this, it just helps to relax that muscle. When you're looking further away, that also helps to relax the muscles through there. And actually, there's been, in Western neurology, science studies, they really show that by, that kind of distance looking also has a really calming effect on the nervous system, takes you out of that sympathetic mode. So this is another reason why doing something like that could be really beneficial. So again, it's nice to, when you start to implement things like this, these little self-help exercises, it's nice to set up a schedule that will remind you to do them. So for example, again, since we're virtual and so much of our time is now spent in front of computers, in meetings, etc. So I encourage you to kind of make this, take a few minutes after those calls, after those meetings, and just spend that time doing, just a few minutes, maybe 5 minutes total to cover these points. Or if you want to focus on a specific area a little bit more, like let's say the eyes, then obviously you could dedicate, like let's say a full 2 minutes here and another 2 minutes here, and then another maybe 2 minutes on the point I'm about to show you. So it's really up to you. Again, you can't overdo it. The only thing that you can kind of quote unquote make a mistake on is that you're using too much pressure. It's not necessary. This is communicating with your body, gently suggesting something, not like taking a hammer and hitting your system over the head with it. Okay, so again, back of straight line to the back of the head where the center of the pupil would be, massaging this as you're looking far away at the horizon, if possible. So, or again, a place really far away in your space in your room. The third point that I want to show you again relates to the eyes and strengthening this. One of my main mentor, Kiko Matsumoto, the style after which her name is the style's name. So she often talked about how she lives in Boston, practices in Boston, and she talked about how when she would go into the city on the train and read on the train, she noticed that her vision started to really take a toll and started to decline. So she started to implement this point that I'm going to show you right now, just to help strengthen and kind of offset that decline as much as possible. So again, so much of the vision and everything is about muscle strength. So this is what this can support it, and just these distal points that have to do with eyes. So for this one, if you just fold your fingers like this, and it's going to be in the middle finger. So I'm using the middle finger at the top of the knuckle. So what I want to do is take a nail from my other hand and then just make little tiny small movements around the top of the knuckle